Next question. I'm a perfectly healthy college student. In order to save money, I pay for my own health insurance through Blue Cross. Currently, with my plan, I pay $50 a month. With the Affordable Care Act, I'm looking at paying over double that amount, and I will be paying for things I don't need. How can you justify this?
I can't, which is why I don't like that portion of Obamacare and the Affordable Care Act and PPAC, all the same thing. But there are parts of it, I must say, Dan's video that I do agree with. I like portability. I like that my daughter can be on my policy until she's 26. I like that we've eliminated pre-existing conditions. But when I am forced to give up something that's important to me, like maybe helping my children go to college, in order to pay for a medical premium that might double, I feel very infringed upon. That's pretty tough for me to swallow. And I might not have any more, and I use myself as an example, but I might not have any more disposable income to use another way. So that part of it, I tell you, I can't justify that.
That's a good question, and I appreciate the concern. Convincing people they need something that they don't see the need for is actually why the individual mandate is in the Affordable Care Act. This is what this country's been doing for a long time. People have not been participating in the shared risk of healthcare. Now, the previous slide showed these clouds down here in the bottom left corner as being much bigger. And they really are right now in Idaho. This question, the person states their rates are going up. And I feel sorry, I appreciate that that is a concern. The goal of this is to make healthcare affordable and lower costs. I believe that will happen. I think there are going to be issues that are going to have to be addressed. And making it affordable for young people, making young people see that there is value in this is important.
And Mr. McDowell, I understand you had a response you wanted to make too. If you were the one, stand up to the microphone. Thank you.
Well, let's explain first and foremost what, excuse me, it's the cold time here. What the Affordable Care Act did to the rating structure from a carrier rating standpoint. You know, if we look at age-band-rated products today, and that would be the individual products that those college students are looking at and comparing to their student health plan. One, they're gender-rated, so you have a male and a female rated column. And two, the slope from the 0 to 19 to the 0 to 6, or 60 to 64 is about a 1 to 5, 1 to 6 sloping from high to low. The law required that the gender rating be compressed into one. So there is no more male-female rating. And it also required that they compress that slope to a 1 to 3. You know, I've been in this industry for 25 years. The challenge that we have today is to get that youth, that young person, to pay for insurance today based on a 1 to 5, 1 to 6 slope. What I can tell you, and we have been looking at the new world rates now for the last, on the individual side, for the last 2 months, it's kicking the young people in the teeth. I don't have any way to sugarcoat that. We already struggle to get them to buy the insurance in today's world. We're going to continue to struggle to have them buy insurance in the new world, whether we like it or not. Understand saying we're trying to make this affordable for everybody, but statistically, you need the youth to offset those of us who are getting older. It's the way it works. If the federal government decided to get into auto insurance and said, okay, auto carriers, you now have to pay for routine maintenance for your automobile, tires, oil changes, windshield wiper blades, car wash. What happens to your auto insurance? it goes up. I use that analogy because the federal government has stepped in and said, health insurance carriers, now you have to pay for this. I am in total support of health care reform in this country. We need it. I understand. I've been delivering those premiums to people for 25 years. It is unaffordable. I'm sympathetic towards that. But this piece of legislation, in my opinion, is health insurance reform. It's not health care reform. If we want health care reform in our country, they better saw on more branches to the tree than just the health insurance branch. From the provider community, to the legal system, to the pharmaceutical industry, to the technology industry, to the consumer. And you've referenced this. We need to understand that we can point our finger at all of those things I just mentioned, but we have 3 pointing back. We do have some skin in this game, folks. And the decisions that we make certainly impact the cost of insurance, the cost of care. Give you a scary little tidbit of information. Talking to an underwriter, verified it with Dr. Rucci at a meeting we were at in Lewiston. There's a new drug for treating hepatitis C. It works. The carriers are paying for it. And let me preface this by saying, whether it's your life insurance, your homeowner's insurance, or your health insurance, it's all spread risk. Okay? We need $1 in to pay for $1 out. The cost of this medication for hepatitis C is $22,000 a month. Now, while $500 in monthly premium seems ridiculous, amen, how many people do you have to have paying $500 a month to offset one person that's taking that med? You know, I wish I had all the answers. You guys, I understand this is, and then talking to other reps, this is probably not going to get a lot of traction because of the marketplace issues that we had in the last session. But, you know, you've heard this from me. There's too much politics in politics.
Amen.